My name's Rob Gross, and I'm the Director of Policy at the Energy Futures Lab, and I'm a member of academic staff here at Imperial College. So I'm your host for the first session. So from now through until we have some tea and coffee at around about 5:30. I'm going to pass over in a moment to Naima from our collaborator organisation, the African Alternative Energy Initiative, and she's going to explain a bit more about what that actually is. And I've got actually only three at the moment, one soon to arrive and three already here, panellists who are joining me in our first panel session. And I'll introduce my panel once the panel session starts. So I think that's enough from me, and I'll hand over to Naima. Thank you.
Thank you so much, Robert. Good evening, everyone. My name is Naima Ahmed, and I'm the Director for Africa Alternative Energy Initiative. And thank you. At the beginning of May, we decided to look at Sustainable Development Goals, most specifically SDG 7. And what SDG 7 talks about is mainly looking at resourceful energy for all by 2030. So in May, we had a panel discussion in Coventry looking at renewable energy versus oil and gas, focusing on the African market. And once we had that deliberation, we realized that there were quite a lot of loopholes that we needed to look at. When you go to a lot of energy summits, energy events, what you realize is there is quite huge over-the-head conversation on energy. And what we thought that we needed to do is to break the whole conversation down, look at it from industry versus industry. And when you speak to a lot of rural African communities, what most people care about is having access to electricity. As to how that they have that access to electricity, they just need light. Some people have access to charge their phones, some have tablets, so many other things. What we are enjoying now, some people don't even have it. But then as much as some people don't have it, other people are dying from the minutest of sicknesses simply because there isn't constant supply of electricity. And lucky for us, we approached the Energy Futures Lab that this is what we wanted to look at. Can we focus on how to power Africa's health sector, how to help people, those who, the health sector, how to power the health sector. So this whole event, the reason why we've converged here is just a means to an end. It's for us to look at solutions, to look at innovations, look at investments for the health sector. One realistic thing is, when you go to rural communities, almost all the health facilities that you have, some either have constant supply of electricity, others don't. Those who do have at least some supply of electricity, they have an aspect of their revenue going into generators and diesels and all that. So that kind of money going into can be channeled into something more, for lack of a better word, resourceful. And when we use resourceful for the renewable energy sector. So for us, it's more about powering Africa's health sector, a means to an end. And to our research, for Africa, you have 6 million, more than half the world's population living in darkness that do not have access to electricity. So if you have 1.3 billion people across the globe that do not have access to electricity, Africa only forms almost half of that population. So there is a huge market. There are individuals who do not have access at all. And this is how the computation comes to. We decided we have the first panel that will be reviewing policies on innovations and then investments, and luckily Robert will be chairing that panel. On the second panel, we were looking to have 4 countries for us to assess. we had Liberia on our table, and the reason why we picked Liberia is 98% of individuals in Liberia do not have access to electricity. We picked Ghana, about almost 83%. We picked Rwanda, and then Uganda. Hopefully by the time we get to the second panel, we'll be able to have detailed conversation. And on the same statistics, we have about 4.3 million people who die every year from cooking with wood or dung stoves. So whilst we are so happy with whether electric stove, gas stove, some people just don't have access to that. And this is the reality. I'll come to the business aspect of it. And this is why we are here. Of all the computation, we also have about 3.4 million people, or 3.4 million children die every year from contaminated water. I will expatiate on this later on as we go on in our conversation. So one child dies every 15 seconds, and you have 200 children every hour who die from unsafe water in that kind of issue. And this is Dr. Donald in Ghana. Last 2 years, he won an award with this picture. He was performing surgery when the lights went out. And he was performing this surgery with headlamps. So imagine you lying there, all of a sudden, lights go out. If there is no headlamps, it's either you are going to die or something needs to be done. There have been instances where midwives had to deliver kits with candle lights. The least said, the better. And there's a midwife with a patient in Tanzania. Lights out, she's also using a headlamp to take care of a woman. And then as we go on discussing all this, the most important aspect of it is the minutest things that you need in rural healthcare. One of it being vaccines, are basic and fundamental parts of healthcare which require refrigeration. So if a whole hospital do not have constant supply of electricity, what do you think will happen to these vessels that keeps flooding into these countries? So these are the facts. Lack of reliable and constant lighting contributes to the death of about 36,000 women a year in Nigeria alone. In Nigeria alone. So you can do the maths later on. You can look at West Africa, East Africa, and then you have 830 women a day die from preventable causes relating to childbirth and pregnancy. Many of those women seek help in medical facilities that have no or limited access to electricity. So we having this conversation is not just the talk. We are here to look at solutions. We are here to probe more into something that can be solved, whether from a business perspective or from a more developmental perspective. And that's why we are happy to have this dialogue today. So why powering Africa's health sector? So reliable electricity is essential for treating medical issues. Patient monitors that measure vital signs allow healthcare professionals to spot and then deal with minor complications before they become serious. And then electric sterilization equipment reduces the threats of the spread of bacteria, on and on and on. And then electrification plays a principal role in reducing deaths. So whether we like it or not, there is quite a huge significance to this topic, and we need to find ways of finding solutions. It's a matter of solutions. And as we keep dialoguing on solutions, it's not just a matter of looking at how can I speak to this government person, how can I speak to this political person. What we are proposing, and I'll come to that in a few seconds, is so how do we tackle this problem towards achieving SDG 7 by 2030? And this is what we are proposing as AAEI. AEI as an organization, we advocate for sharing dialogue, looking at solution, looking at investments. But the proposition is, there is always a business venture. When you approach an African man with a project, so as far as there is money, so as far as there is a business idea to it, he will gladly want to have a discussion with you. with or without government. So the whole dialogue, we need to look at it from a more business perspective. For powering Africa's health sector, you have a lot of hospitals that already spend about half their revenue into generators, into diesels to power their healthcare systems. So that amount of money, if we are able to look at significant modules to suit these healthcare facilities, it means we are looking at something quite significant at the end of the day. That is business. Once we keep dialoguing on this, if you have a health director, a renewable energy developer coming together to say we have the right packages to suit rural health facilities, you only force politicians, you only force government bodies to review whatever policies that there is for things to happen. From 2030, I think every African government is rather going back to the drawing table for us to look at Africa beyond aid. And looking at Africa beyond aid means we are discussing the right solutions. We are discussing the right thing that comes with the right profits for all of us to benefit from. Individuals have to start tapping into solutions that does not look at how much am I going to get from IMF, how much am I going to get from this foundation or that. We need to look at modules that will be substantial for our own benefit. And that's why we've invited you here. So we are looking at distributed generation with direct community and industry engagement to ensure lasting solutions, and decentralized renewables to promote innovation and entrepreneurship. At the beginning of this year, when we kept visiting most of the high commissions, I remember one particular communication with the Uganda First Secretary vividly. That, oh, Naima, why do you keep worrying yourself with these renewables? I said, it's the future. Most oil companies or oil and gas companies may or may not agree with me, but then when you keep looking deep into it, looking at climate issues, this is the future that we are looking at. And say, I quite agree with you, but then I'll share this with you. In my village, my mom doesn't have access to electricity. So with all these talk about solar, I bought solar panels from UK for my mom back home, so that they'll be able to fix it on the property that I've built for her. Once the whole panel have reached there, they couldn't find a single person to fix it. The electrician within the village who came to be able to fix it came with AC wires to fix solar panels. So the issue of renewables, health sector, whether solar or wind, it cuts across so many angles. You are looking at training, you are looking at entrepreneurship, because you need to come up with modules. When you look at Kenya, when you look at Uganda, there are so many interesting modules that have worked for them. And the interesting thing is, for Kenya, you have all these renewable energy companies that comes in, and what they are doing, they are integrating with telcos. So it's not even a matter of government paying anything. It's individuals paying with their hard-earned money on their mobile phones. This is what is happening. So if you are from a renewable energy company, this is the future. It's not a matter of, can I speak to the Minister of Energy? You need to sit down to look at modules that will be able to help us to look at significant solutions at the end of the day. And I think that is what the two panels will be looking at. And if you have any questions, we expect you to come in. We hope to have very interesting dialogue today. So the benefit from our proposition is there will be direct business opportunity for renewable energy developers and various industries who are in dire need to find solutions to power outages. One of the projects that we have is there's an association of bakers in Nigeria. And one of our contacts just sent to us. They are already spending half of their revenue on generators in Nigeria. So somebody told them about solar panels. They know for sure they do not have the upfront money to tap into solar. But then they know when they come together as a community, they'll be able to get off-takers from the banks to be able to guarantee the amount that they are looking at. And these are about 350 women who are into bakery. This does not require any government person to come in. This is pure business. So there is direct business modules with sector integration to ensure returns on investment. And for places, when you go to Europe now, everybody is on Facebook. In fact, those who don't have money to buy phones. And they have money to buy credit. So if you are able to top up your phone, you need to find means of charging these phones. And once you are finding means to charge these funds, it means you have something to be able to pay for. And that is the kind of, I think for Kenya, Uganda, Malawi, these are the kind of modules that's coming up. So we need to explore these modules for business advancement. And then there is the issue of local content engagement and employment, and I'll talk about it later on when we come back. So disadvantages, we've explored it to the best of our ability. If you think there are loopholes, that's why we've invited you here to have this conversation. We need to find solutions from a business perspective, from a realistic perspective, from an achievable perspective, and that's why we've convened here. For AEI, it's a startup initiative, and we think the dialogue of just bringing people together just to talk the talk and then go back home is way beyond. We are here to find solutions. And finding solutions is looking at how do for the typical African is, how do we get money in our pocket? How do we feed our family? So if you know how to communicate with any African, you surely know how to do business. Because for most people, you know your packages, you know your products, you know how to get things done. And there are people who are dying simply because there is not constant supply of electricity. We need to do something about it. And once we are talking business, we know at least we are solving. It's like having the icing on the cake. Once you do the business in the right way, you surely know that you are saving women dying from the minutest of diseases which shouldn't be. We will be saving people who would, in one way or the other, would have died from something that shouldn't have been. So it's a win-win situation. So let's get the tweeting going. Let's get the conversation going. And we will start with the first panel. Thank you so much for listening.
Okay, so that's some stimulating stuff, and thank you very much for that. So what I'd like to do now is to invite my 4 panelists to come and join me in these extremely comfortable looking torture chairs that we've prepared for you at the front. Sarah, would you like some water? So, I mean, these are issues that many of us here at Imperial College have been interested in over quite an extended period of time. We have students every year working in a master's thesis and so on in Africa and in other parts of the world where access to energy can't be taken for granted, and we've got a long-standing interest in both the technologies and in the business models. Many of you would be familiar with the company Bbox, which was spun out from by some Imperial graduates a few years ago, which provides one example of a means by which modern mobile phone payment technology and the solar and storage technologies that are all declining in cost so rapidly can be made to provide one route towards energy service provision. And we're interested in exploring more of those routes and in understanding the relationship between technology, policy, and finance and business opportunities. There's a great deal of interest, as I'm sure all of you know, on the international stage in some of these opportunities, and within the UK context from overseas development assistance, DFID, and other funding sources. So that's certainly something which has focused minds in the academic community. So I've got, my role is not to stand here and talk at you, so I'll stop. I've got a distinguished panel, which we've invited to not give you long presentations with lots of PowerPoint slides, but actually to give 10 minutes or so, 5 or 10 minutes of their thoughts on the general topic of increasing the use of sustainable energy and the role of policy and other factors that might help to facilitate and stimulate investment. Now, I've got their little biogs. I know one of them well, and the others I'm just getting to know. So forgive me whilst I read from the sheet. So we have taking from one side to the other. We have Elizabeth Nyeko. Now, Elizabeth has recently joined a new centre which has been formed in the business school here, the Centre for Climate Finance and Investment. But she's also the co-founder and CFO of a clean tech venture called Mandulis that deploys new technologies and approaches to provide energy services to homes, businesses and industries across East Africa. And I'm sure that she will tell you some more about how that works and the technologies that are involved. She was also, I think this is particularly impressive, was recognised at the World Economic Forum as one of the top female innovators in Africa. So well done for that. From my second on the right is my long-standing colleague Judith Journey, who we've worked together for a long time. She's a research fellow and lecturer in the Centre for Environmental Policy. She focuses on international development, energy technology, sustainable development policy and markets, modelling energy and policy in emerging economies, with a more of a focus on Latin America, but not exclusively so. Also China, Asia and Africa. And she has interests in the issues of globalization, poverty and the environment. And she's a social scientist, and she takes that social science approach to some of these issues. We also have some non-Imperial College people here, I assure you. So we have Sarah Wykes, who's a lead analyst on climate and energy at the NGO CAFOD. And Sarah leads CAFOD's policy work around climate change and energy. And CAFOD's partners, I mean, it's large NGOs, I'm sure you're aware, working around the world to reduce greenhouse gas emissions, focusing on poverty eradication and sustainable development. And that's very much the current focus of Sarah's work, which is on access to sustainable, affordable, reliable and safe energy for people living in poverty so that they can meet their basic needs. Okay. And Ryan Hogarth, who's a consultant at Oxford Policy Management, OPM, and OPM actually are the lead for a DFID-funded project, which is the Energy and Economic Growth Applied Research Programme. I'm glad I managed to get that mouthful out. He's also, prior to joining OPM, he worked for the ODI, and he took part in a research team also at the Smith School, which is at Oxford University, which was working on with the government of Rwanda to develop a national green growth and climate resilience strategy. Okay, so I've managed to get through the biogs, I think, without too much stumbling. We're now going to invite the panel to make some contributions. We will then open it up to contributions from the floor. The only two things that I would ask you to do when you're asking your questions or making your observations would be, one, to wait for a microphone to arrive because we are recording this for a podcast, and two, to say who you are. Okay, so I'll run along the panel in the order that I've introduced them, starting with Elizabeth. Okay, thank you.
Thank you very much. Yeah, so I will focus on Uganda in particular, primarily because that would be the particular area where I have the most experience in. both from the point of view of developing renewable energy projects as well as engaging with policymakers. So I would actually say that Uganda perhaps presents one of the examples of countries in Africa that have actually seen very interesting success of particular policy initiatives that have come to be over the last 17 years. It would start perhaps in 1999 with the electricity, the sort of the unbundling of the Uganda Electricity Board. And that particular policy implementation resulted in a scenario where the government controlled everything from generation to transmission to distribution, to a scenario where actually generation was privatized, transmission still owned by the government, and distribution entirely privatized. Now, in this particular type of a picture, they were able to attract a significant number of independent power producers to join the power generation space. So classical, roughly now we went from a space where generation was purely government-led, government implemented, government operated, to a scenario today where in excess of 44% of the entire power supply, roughly about 850 megawatts worth of installed capacity, being privately owned projects. And over the next few years, what we found in particular was that a number of other policies, particularly that provide a substantial amount of support to renewable energy and also to rural electrification, were implemented. And these had mixed success. I would say the ones that focused on grid and adding power supply to the grid were quite successful. So one example being actually the renewable energy policy for 2007, and that in particular looked at saying, okay, well, can we streamline the power purchasing agreement framework to help fast-track renewable energy projects, for example. And that, around 2011, actually ended up in a highly developed framework that really, that on the one hand, it made it easier for new developers to come in and bring online projects. The tariffs were low, and that meant that it didn't actually attract quite as many developers as was hoped even. But then that was developed on into what was called the Get Fit program, which then brought in it was an entire consortium with KFW and a number of sort of donors working together with the Electricity Regulatory Authority, and that one actually then added a sort of a top-up tariff on top of the original tariff, and that one resulted in actually up to 128 megawatts worth of installed capacity being added on to the grid. Obviously, some of these projects are yet to come online, but they've been able to attract about $450 million worth of funding so far. So you can say that it has been a success. On the off-grid side, however, policy has been less clear. It's been more about increasing access to, well, rather expanding the grid to urban areas and to urban areas. And this is roughly an environment where maybe 15% of people are connected to the grid across the country. And increasingly it's becoming clearer, I would say, to policymakers that maybe going the direction of grid expansion might not be financially viable, and perhaps other models like solar home systems might be a better route to go. And so we're seeing actually significant growth in that area. B-Box was mentioned earlier. There are other companies like Mkopa that are also driving growth in that space. And on the other hand, you have also the mini-grids. And mini-grids have actually ended up being, actually not entirely viable as an approach, mainly because of the costs that they end up having to charge. So tariffs of about $40 per kilowatt hour compared to the grid at 21 cents. not very encouraging, really, in terms of people being able to afford. So willingness to pay. So even though there's a need for electricity, willingness to pay and affordability are key factors that need to be considered in these settings. So in terms of new business models and new technologies that could actually enable growth, both on the grid side and the off-grid side, I think there's plenty of really interesting approaches. On the grid side, I think there's a huge amount of scope for sort of grid balancing type solutions and potential even for peer-to-peer electricity solutions. So classic examples being the ones where you have sort of distributed ledger technologies that are used to allow for consumers to actually generate their own electricity to be able to share electricity with their neighbors. But then once you start looking at these types of innovation, then you need the policy side to really grow alongside of that and provide frameworks to make it possible to actually implement these types of solutions. On the off-grid side, one of the other business models that I would say actually has been growing in success is one which looks at really being able to drive economic development in rural areas. So if you can increase people's incomes, then they'd actually be able to afford electricity. But then that requires a longer term focus on profits. So sort of, so being able to make investments, perhaps without entire clear picture of returns, but then be clear on the data. But then the issue is now when it comes to data on demand, there's very, very little data on demand. So on both sides, there's always interesting technologies that can be applied, but at the same time, kind of downsides that people need to consider. So one particular approach that my company has been using, for example, is focusing on biomass, in particular gasification of agricultural waste. So we buy the biomass from farmers, pelletize it, torrefy it, which really reduces the moisture content and makes it possible for us then to use that in gasifiers to produce electricity. And this electricity is different from the electricity that you'd get from solar in that from solar, you're getting electricity that is just enough to charge your LED lights, just enough to charge your mobile phone, but it's not enough to run the rice mill, the maize mill, and really power economic development. So with gasification, you can actually start looking at solutions that can drive growth locally in a sector that, in our opinion, matters quite a lot because nearly 80% of the population are employed in farming. And if 80% are employed in farming, then there has to be an increased focus on being able to power this sector and add value to agricultural produce in order to be able to really be able to allow these a very significant proportion of the population to contribute to economic growth. So I'll take questions at the end, but I think I'll close there and pass on.
Yes. Okay. Good afternoon. When I looked at the title of this this afternoon, the first thing I thought is, yes, I know something about energy, but not much about health. And I thought that it was important that when we talk about the health sector, we mean the health sector on or the health of the population. I want to thank the first speaker for giving so much background. I didn't know that that background could be presented here. And I did a very small sort of review on the health of Africa and what are the problems. And in respect to that, I would like to say that I want to mention 3 points in order to address the challenges surrounding energy access and constant supply for health and care facilities in Africa. And those 3 points are, the first one, the state of health in Africa. Africa is the world's less healthy continent. Many diseases are endemic and often prove fatal when they are not treated quickly and efficiently. Africa has been hardest hit by the HIV/AIDS epidemic. Malaria is widespread and kills one African child every 30 seconds, as it was mentioned. Other diseases are polio, elephantiasis, leprosy, helminthiasis, trachoma, the eyes, yellow fever, cholera. Fumes and smoke from burning firewood and dung to heat homes and cook cause about 4 million deaths per year in Africa, mainly among women and children. And that is more deaths than from malaria and HIV. The second point that I wanted to mention was the problem of poor infrastructure. And I want to mention this because it is related to energy. Lack of electricity in Africa remains one of the biggest barriers to the region's development and prosperity, and continues to trap millions of people in extreme poverty. Many communities lack clean water, proper sanitation facilities, and energy, mostly in rural areas. Access to health clinics can be difficult, and certain treatments or prevention methods can be very costly. Lacking modern energy services and heavy reliance on traditional fuels affects the poor in particular and makes escaping poverty more difficult. Escaping poverty, or not able to escape poverty, means that the poor is trapped in poverty, and one of the reasons is particularly the lack of energy. Poor households use less energy than wealthier ones. This means that less water is boiled for drinking and hygienic purposes, what in turn increases the likelihood of waterborne diseases, such as cholera, diarrhea, and dengue, which in turn reduce the ability of the poor to work effectively, continue education, and improve livelihoods. So that is the chain. Light can keep rural medical clinics open for women who go into labor late at night. Energy is necessary to keep vaccines and medicines refrigerated. Clearly, appropriate supply and use of energy can improve water access, healthcare, education, higher life expectancy, and economic opportunities. Yet, because of Africa's little installed electricity capacity, energy consumption is very low. The irony of Africa's energy poverty is that Africa is actually very rich in energy resources, but most of the continent's energy potential is unexploited. The third and last point is how can policy help? It is foreseen that renewable energy will play an important role in Africa's energy mix in the coming years. Political momentum is actually building now. Affordable and clean energy is one of the 17 Sustainable Development Goals. The UN Sustainable Energy for All aims to ensure universal access to modern energy services, double the global rate of improvement in energy efficiency, and double the share of renewable energy in the global mix by 2030. However, also national governments have a large role to play in ensuring that these developments occur. Government policy will need to prepare the grounds for private investors and promote regional integration where advisable. Inspiration may be drawn from countries which have sanctioned renewable energy laws, even if these laws may not be perfect. Such countries as Peru, Colombia, and China. Remember the rapid rural electrification achieved in China, which draw on supportive policies and a rural grids approach, or small rural grids approach. Argentina developed a concessionary approach whereby international donors and lenders, national government, and national intermediate power producers come together to supply energy to poor and remote areas. Feed-in tariffs have been widely implemented too. The free solar heater program for South Africa townships is worth mentioning. Also, inventive solutions can motivate new ideas. Cuba developed mobile health units powered by solar panels, which provide health services in remote areas. Finally, implementation of successful policy framework and diversified energy portfolio would be important for Africa. Private companies, donors, and policymakers could benefit from consulting advanced decision-making tools and approaches to assist the selection of most appropriate energy technologies. And, importantly, learn about people priorities, demands, health status, and needs. By doing so, powering Africa's health sector would also empower those who lack energy access and suffer ill health.
Okay, thanks very much. I'm just going to start. I'm going to try and dial this back and keep it quite simple. I'm just going to say a little bit about CAFOD's work in this area, why we're working in this area, and then talk a little bit about what we would see is there's two elements of the kind of health crisis that access to energy can help to address in relation to this topic. And then wanted to talk a little bit about from our perspective, and again, we could perhaps get into some of this in the discussion, about why, from our perspective, there needs to be a kind of a holistic approach to the health sector as a whole. So looking at energy as one particular input to a whole range of approaches that are needed to help develop that sector, just as it would be, for example, to develop energy for productive uses would be one input to developing rural smallholder agriculture, for example. So just for those that you don't know, so CAFOD is the acronym, as an acronym means that the Catholic Agency for Overseas Development. So we are the official aid agency of the Catholic Bishops' Conference of England and Wales. So we work with partners to deliver development programs and humanitarian assistance in 37 countries around the world. And we have this partnership model. So we don't implement programs directly. We work to support partners who themselves are working with some of the poorest communities in the world. So why is CAFOD working on ending energy poverty? SDG 7 has been mentioned as a kind of key reference point in terms of the new Sustainable Development Goals framework. It's a strategic priority for us because we're coming at this from a kind of development and social justice perspective. And also, from our perspective, the current energy system, fossil fuel-based energy system, is not delivering for poor communities around the world, both in terms of it's sort of the main driver of climate change, which obviously is pushing people further into poverty or keeping them in poverty, and it's not providing them with access to the energy services they need to lift themselves out of poverty. So obviously we don't have time. There's a huge body of evidence on the positive impacts of access to energy services for human development, and how this can improve human development outcomes, including health outcomes. I just want to mention, I know what we're talking about here is we're talking about access to power for the health sector, and in CAFOD's case, we would be looking at rural health clinics primarily in terms of where our partners work. But I just want to mention, as I said, there's another huge health crisis going on in relation to the 3.04 billion people globally that still cook with polluting solid fuels, obviously with devastating health impacts, and that's been mentioned here in terms of that being the single most important environmental health risk factor worldwide. Biggest environmental killer ahead of many others that have been mentioned, and particularly impacts on women who tend to do most of the cooking and children under 5. So that's an ongoing health crisis, and unfortunately the news is not very good. With business as usual approaches, we're not making any real progress in terms of moving those over 3 billion people off solid fuels onto cleaner cooking solutions. Access to electricity for community health services. I just want to share one example from our work in Kenya with partners, we did a big community-based green energy program, which was basically solar, to do with solar. That was delivered over 4 years in rural and peri-urban areas of Kenya. It was a partnership between CAFOD, 2 Catholic dioceses of Kitui and Isiolo, an NGO, and a private company called SolarWorks, and local stakeholders, and this is really important. So working with county government, working with national government, and with line ministries in particular. The program overall impacted on over 490,000 people. In terms of the health sector, the program provided solar refrigeration and lighting. We heard about the importance of solar refrigeration for keeping vaccines, for looking after vaccines in 48 clinics. Also provided solar water purification for 19 clinics. And some of the impacts, as you can imagine, obviously increased vaccination of patients since vaccines were actually available and could be kept in the clinics. Increased patients' attendance, things like, I think it was mentioned in the introduction, women actually going to the clinic in terms of giving birth because there was light in the clinic. So some very obvious development benefits there. So obviously the discussion today is focused on access to power for the health sector, but I just wanted to remind us of the ongoing public health crisis in terms of cooking, the huge numbers of people who cook with solid fuels. So I would just want to also stress that from what research shows and from our programmatic experience, when we're thinking about delivering community energy services, we need to make sure that this is done in a holistic way, and that we're not just talking about an electricity connection, that has to be a usable electricity connection. So this is why in the SDG, we at CAFOD worked with others in terms of the SDG language, the emphasis on those services, that power being affordable, reliable, sustainable, and we would say safe, and of sufficient quality and quantity to make sure that people can actually use it. So it's no good providing power if it keeps cutting out, if it's only available for 2 hours a day, if it's too low voltage to power certain equipment, et cetera, and what our research shows, and something that we're working with partners on at the moment, is we want to look more at, if you really want to deliver development impact in terms of access to energy services, so that could be for health, that could be for productive uses, for example, then if you want them to be financially, environmentally, and socially sustainable, there needs to be much more focus on tailoring those services, so both the design and delivery, to the needs of end users who live in particular socio-cultural contexts, and those contexts vary, and those local needs will vary, and there is no one-size-fits-all. So I think we can get a bit hung up on technology and business models, but actually the business models, the ownership models, and the approaches have to be appropriate to different local contexts. And I think any practitioner working in this field will tell you that what works in Bangladesh will not necessarily work in northeast Kenya, for example. So that's something that we're very much trying to look at in terms of participatory planning of energy services at the moment, working with partners. That could be on a project level. One thing we're going to try and do in Kenya is working with county government now in terms of their county energy plans that are being developed. So just want to finish by saying, just to the point that in the case of community health services, addressing the energy gap is just one aspect of this. To have impact services, you need other vital infrastructure and inputs, trained health personnel, sufficient supply of medicines, community health education, and all the other supporting services. So those services, again, need to be, when you're planning those services, that needs to be a holistic approach. If you're just providing power, what the research shows is you're not going to produce the positive health outcomes. So I'll leave it there.
Thank you. I'm going to start by talking a bit about my role and the work that I do in this area. I work for Oxford Policy Management, and we lead the applied research program on energy and economic growth, and we call it EEG, so it's less of a mouthful. EEG is a DFID-funded research program. It's £13 million, and it's a 5-year program. We're currently in year 2. We focus exclusively on research on large-scale power systems in sub-Saharan Africa and South Asia. I should say that up front. It's not that we don't think that small-scale off-grid systems are important, or mini-grids are important, or clean cook stoves are important. It's that DFID has other programs that are focusing our research in these areas, and so we stay within our own scope. EEG is a bit different than a lot of other research programs, like those that are funded by the Research Council and hold open calls for proposals, where the proposals are coming largely from the researcher. Instead, we work very closely with the users of the research. So we work closely with governments, utilities, other major decision makers within energy sectors, and we ask them what types of research they need done. We also do a lot of work on the back end to support capacity development and provide support to ensure that EEG research findings will get translated into impact. So we've spent the first year trying to scope out that demand, and going forward, we will be funding research in 4 priority research areas. These are grid access, increasing the share of renewable electricity on the grid, improving the reliability of electricity grids, and improving the productivity and efficiency of electricity use. I'll stop there, but if you are interested in the program, please do reach out. I have some propaganda in my bag I'd be happy to share afterwards. And I'll turn now to the issue at hand, which is innovations to unlock further investment in powering Africa's health system. I'm gonna first talk about why we need innovations, and then I'll talk about the types of innovations we need. And I think, do we need innovation is a good place to start. It's a fair question because you look across a lot of the world, and health facilities are powered by bread and butter grid connections. There's nothing innovative about them. And it's even further fair to say that even with the rapid improvements and costs in off-grid solar and other off-grid technologies, grid connections are still the first choice for health facilities, all else being equal. And the reason is simple. It facilitates scalability of services. Imagine if you were managing a clinic and you had solar electricity, and you were using that solar electricity to power some lights, maybe a small refrigerator, maybe some basic surgical equipment like for suturing. Perhaps you're using it to power some communications technologies. But you wanted to purchase more equipment. You wanted to purchase an ultrasound, you wanted to purchase an X-ray machine, or other larger appliances. You would also need to add capacity to your system, and that could more than double your cost. And it may be off-putting, and you may not invest in that new technology at all. If you're connected to the grid, those costs are instead borne by the utility. And so why do we need innovations if the first best solution is already known and already used across much of the world? Well, the reason is that in sub-Saharan Africa, as we have heard, all else things are not always equal, and there are many circumstances where off-grid options are preferred to on-grid options. And the reasons are that reliability of electricity systems in many sub-Saharan African countries is terrible, and clinics will require, even grid-connected clinics will require a lot of backup supply. And also, many clinics are located a long way away from the electricity grid. Practical Action has estimated that 30% of all health facilities in sub-Saharan Africa don't have access to any electricity at all. So what it comes down to is the grid connection the better option or the off-grid connection. It really depends on how far away that health facility is from the electricity grid and what types of services it needs to power. And USA did some analysis around the different energy demands of different size clinics a few years ago. At the time, I was working for the Overseas Development Institute, and we crunched some numbers to do some comparison across different technologies and which ones are preferred in which situations. If you look at the smaller clinics, the ones that tend to exist in rural areas far away from the electricity grid, their energy demand or their power demand is between 5 and 10 kilowatt hours a day. They use it to power lights, to power small surgical equipment, maybe small laboratory equipment like I discussed before. And what we arrived at was if those clinics are located more than 3 kilometers away from the electricity grid, there are many off-grid options that are more cost-effective than extending the electricity grid. These include solar PV and batteries, solar diesel hybrids, wind power, if it's available, if the resource is available. Anything less than that, then the grid becomes more and more attractive. And of course, that distance is shrinking with the rapid declines in solar PV. So I guess the answer to the question, do we need innovation? Yes, we need innovation both on expanding the electricity grid and innovation on how to improve access to off-grid technologies. So what types of innovations do we need? I'm conscious that we're sitting here in an engineering department, and so I'm a bit hesitant to say, but I don't think that any of the innovations that are required are technological in nature. I think they're more around finance, they're more around policy, they're more around trying to reform the power sector so that the right incentives are in place for all the actors. There are technological innovations that will help, don't get me wrong. Increased energy efficiency in medical appliances will definitely help for off-grid solutions. Increased storage or improved storage and cost of storage will bring those costs down even further. But most of them are of the former variety that I mentioned, and I'll explain. In terms of expanding grid access, the reason it's not happening primarily is that most utilities in sub-Saharan Africa are seriously cash constrained, and many are facing insolvency. And for them to invest in added transmission to get to rural areas, they would need to see a return on that investment. And there's so little demand in the rural areas where they want to expand to that it doesn't make financial sense for them to do it, and they're probably not able to access credit to do it in the first place. Also, for political reasons, tariffs are often kept low to increase affordability of electricity, but that reduces their incentive structure as well. And so there are a lot of potential innovations around making it more affordable for utilities to invest in this infrastructure. We talked about power sector reforms that could unlock investment. We also talked, or we haven't talked about, but there are ways to incorporate the upfront costs of that grid extension into the tariffs to make it a viable option for utilities. In terms of expanding off-grid energy technologies, again, the upfront costs are the main issue, and there are innovations around financial structures that could unlock distribution of these technologies. Talking about the same clinic, the very small one that demands about 5 to 10 kilowatt hours a day, the capacity that clinic would require is somewhere around 1,000 kilowatts, or no, 1 kilowatt, sorry, 1,000 watts, and the range of clinics is up to 6 kilowatts. To put that in perspective, that's about 100 times or more higher than the average units that are being sold by MCOPA or Azuri, and that's probably why you're saying that most off-grid solar is just providing lights and mobile phone charging. That doesn't mean it's not technologically feasible or even economically feasible. It's just that that's not the type of electricity system that tends to be sold in rural sub-Saharan Africa. And so there are ways to spread those costs over time. And what MCOPA and Azuri have done is one example of doing that. There are also credit mechanisms that can help unlock investment in these technologies. The other area of innovation has to do with expanding distribution to rural areas and improving after-sales services. The African solar market, at least on the consumer side, has really focused on much smaller units. B-Box would be an exception. It provides units up to 300 watts. And so these larger systems are available in urban areas, but the majority of off-grid areas have much smaller systems, and 85% of all solar systems sold in sub-Saharan Africa are under 8 watts. So we're talking about an entirely different market segment than what's already there. And there are innovations around business models that can help off-grid solar suppliers to start providing these technologies and to expand into rural areas. And I think I'll stop now, but I will conclude by saying one further thing, and that's in order to achieve the SDG and to promote access to electricity for all of Africa's health facilities will require significant political commitment. If you go anywhere in the UK, for example, even to the most rural town, you will see that it has access to electricity. And that's not because it turns a return. That's not because it's a good business to extend electricity out there. That's because there's been a political commitment to say that everybody deserves access to electricity in this country. And I think that the new SDG, SDG 7, shows that the politics are now coming around, and we have committed to extending access to electricity, regardless of whether it is good business or not.
Okay, so this is the opportunity for us to turn around and face you guys, and to see what questions and observations we have from the floor. I have a few of my own, but I'll hold on to those for now because I've got at least 2 hands, so 3. So I think what I'll do is I'll collect the first 2 of those, and as just a reminder, if you could wait for the mic, and if you could say who you are and your affiliation before you ask the question, please. So there's a gentleman here in the middle of the row, and there's another gentleman on the sort of towards the back on this end of the row. So I don't know where the mics are, I'm afraid. Okay, so we'll reverse the order, and if we could go with your question, sir, please.
Thank you very much. My name is Alfred Kuma. I'm an electrical power engineer. I work for Transport for London. I'm originally from Ghana. I'd like to thank you for organizing this talk. Can you hear me?
No.
You can't hear me?
No. He can hear you now.
Okay. My name is Alfred Kuma. I'm an electrical power engineer. I work for Transport for London, and I come from Ghana. And I would like to thank the organizers for this talk. I have an issue with I think I heard you said power penetration in Ghana is, those without electricity access is 87.3%. Is that right?
Yeah, it's around 57, and then you take Uganda, Liberia is around 98.
Oh, okay. All right, I think we shall discuss that later,
yeah.
because I used to work for Electricity Company of Ghana, so I have a little bit of knowledge about that.
Ghana is around 57. Okay. It's actually Liberia that I said 98%.
Yeah, okay. From all the speeches, I haven't heard anything about technical economic. I heard about investment, profits, etc., etc. But the last speaker hit the nail on the head. He said in this country, we have electricity everywhere, not because it made economic sense, but because there was a political will to extend those facilities. In the United States of America, in the 60s, they had rural electrification project, which extended electricity to all areas of that country as well. In this country, we had CEGB, Central Electricity Generation Board, which was later sold as a private company. So what I'm trying to say is that there must be a political will in Africa for governments to finance some of these projects to start with so that they can lift people out of poverty. But if we are talking about innovation, investment, profits, at this moment, where our own prime minister in this country said the electricity market in this country had broken down. We had the financial crisis. The financial market had broken down. I'm afraid I don't support this type of proposal for Africa at this moment. I think government should, those of you who meet government officials, you should tell them to buy less of expensive vehicles and you use those monies to develop the infrastructure of the country first and foremost. And secondly, we should add value to our products. For instance, cocoa prices are fixed in London, not in Ghana, not in Cote d'Ivoire. But when they come here to buy your equipment and plant equipment and vehicles, you set the prices. So those things must be reversed so that you open your markets to African products. That will lift Africa out of poverty. So when we get enough water to drink, electricity to power our health facilities, then you can come up with market initiative to get your profit. Thank you.
Okay, so a clear challenge there, and a fair one, I think, to the various kind of concession-based and private sector-led, donor-led initiatives that have been very fashionable in favour of perhaps a more traditional monopoly grid-based approach. So anyone wants to respond to that challenge?
I have nothing to add except to say I agree.
Yeah, completely. But I think governance is absolutely crucial. And for us, I would say it's about how participatory is your decision making about energy. So if you're looking at the energy planning, how much is that actually responsive to people's actual needs? I mean, there are huge issues around quality of data. So, at the moment, World Bank is trying to do these, what they call the multi-tier framework surveys. So they're trying to look at what are the real levels of access in different countries with the hope that that will then basically could inform better kind of energy planning. For us, we very much support the idea of, amongst our partners of civil society. I mean, these are very technical discussions often when you're coming to the energy sector and energy planning. But for us, the more you can have citizens informed, participating in those kind of planning around energy, the better, basically. I completely agree with you that the governance is a huge issue and what government priorities are in mobilising domestic resources. But I would also say that I think what mix of public and private finance you might have is also very context specific, and that will depend what are the particular development objectives of that country, what is their energy mix, what the cost benefits of different generation mixes and all the rest of it. So there's a lot of complex things that need to be within the energy, looked at within the energy planning, but we very much favour more inclusive energy planning and decision making.
And not much to add. I agree totally with what you said. I think that the government has a very important role to play, but we cannot ignore that many of the economies in Africa have been liberalized and the market economy is dominant. So someone has to take responsibility for what is called market failures and rural electrification and electrifying the poor areas is not attractive. So someone has to do it, and if we have to draw on international agencies, donors, call the government to participate more, I think that is our role at this moment. I mean, I agree with you, and that the dominant debate surrounds the language that you at this stage are criticizing, but that is also the reality.
Thanks. I would say I partially agree with you. From the perspective that, yes, absolutely, I certainly agree with you in the point that governments do have a vital role to play in electrification, be it rural electrification or even just expanding the grid. However, at the same time, there has to be a clear delineation of what the government will be responsible for realistically, right? Because there's the idealistic world, then there's the reality. And when you're looking at reality, ultimately people are off-grid. And so there's one picture where we could all sit around and point fingers. Then there's another picture where we could actually work together with government and clearly split roles. And, for instance, when it comes to financing and raising capital and things like that, government where does government get its money from? Taxes, okay? Or selling land, typically. And can you really tax a population that already has very little to nothing, to raise capital, to invest in these things? So, you sort of, the dialogue really needs to change about getting new and more viable sources of capital to invest into these typically very capital-intensive businesses, or, infrastructures or services for the population. And on the other hand, there is a significant amount of capital available, private capital, and I would argue even a significant amount of patient capital that is available to be put into such projects. So the role of government really still continues to be vital, but more from the point of view of planning and providing clear frameworks, regulatory frameworks, policy frameworks that make it possible for those who have the expertise in terms of capital raising or have the expertise in terms of putting together projects and selecting the right technologies for specific problems to actually come in and address it. So it won't be, but at the same time, the government also needs to be able to manage, the sort of tariffs that end up being that people end up being charged. Of course, I mean that has to be looked at, because what's the point of having access to electricity if you can't afford it? So there are examples of kind of mini grid type projects that are charging in excess. I mean, $4 per kilowatt hour. I'd rather stay in darkness, even if I'm in London. And so really the prices of electricity need to come down. But really, it can only come down if you have the right type of policy frameworks in place that reduces the risks that people need to take during project development, that also reduces, and also providing people with the kind of data that they need. So a classical example would be, say, providing a master plan for which areas will be electrified, which areas won't be electrified, when, providing the kind of data that people need to be able to come in and execute some of these projects. So that would be my opinion from that point.
Okay, so a great set of answers. I'm conscious of time. I don't want to steal time either from, well, I will steal some time from the coffee break. I don't want to steal time from the next panel. So I've got a number of people waiting to come in. If you could keep your questions fairly succinct, and don't feel that you all have to answer. Let's get a chance for more dialogue, please.
I am Stuart Dorby, and I'm the joint editor and publisher of greenbarrel.com, which is a website which core business is investment in renewable energy through quoted companies, but we also write about all general topics, Hinkley Point. And in answer to your question about electricity prices coming down, I've just written a huge article saying it would come down if somebody would do something about the cartel of the big six, ripping everybody in this country off. But my question is basically about batteries and the very exciting battery race that's now going on. And I'm a little bit surprised that none of you sort of mentioned this, and the role that batteries can now play in both off-grid and on-grid developments. The missing link in energy is storage in renewable energies, as we all know. Now, in Germany, talking about the grids, on-grid, they have now got their ratio of renewable energy up to 33%. 43% of that is from cooperatives, farms, households, which put lots of batteries up in their attics and sell the surplus that they don't need to the national grid. Now that is quite extraordinary when you think about it. In the percentage in the UK is only 5%. That might be slightly skewed by the fact that they count nuclear as a renewable energy. But on our website, for example, we have a company called Red Tea Energy, which has a contract with a 15 megawatt solar plant in Somerset, where using vanadium flow batteries, it can time shift or store for 12 hours. Now, in Lewis, where I happen to live some of the time, there are also eco houses which have lithium batteries that do this. Now, think Africa is absolutely made for off-grid storage. And shouldn't some investment go for, in fact, if you can do it with 15 megawatt power plant or a house, up, two down in Lewis in Sussex, surely you can do it, expand in Africa, and it is a question of investment and it's happening, and that is very exciting. Forget Elon Musk and his lithium batteries, but just what else can be done. And there is investment now, and that's a good thing, but shouldn't there be more? And isn't Africa sort of made for this kind of thing? Okay. That's my question.
Okay, thank you. Anyone want to take that?
Certainly.
Okay.
Okay. So yeah, batteries, very good point. The only issue I would say with batteries at the moment, it's very exciting technologies, lots of great progress. However, it's not yet cost effective at the small scale. So really, for example, so you've got to think of the cost of batteries, and then you've got to think of the cost of the inverters. And then, you're sort of already adding up on your capital costs and getting to a point where it, again, tips over the tariffs to a point where it's not necessarily viable. Yeah.
I think we could have a very long and very interesting conversation about battery technological progress and economics, but unfortunately I've got a number of people wanting to come in. I'm being signalled that we only have 5 minutes left. I've got a question at the back, so Zainab, and I've got a gentleman here in the middle, and I will try and bring you in, Hayden, as well. I can see you signalling from the side of the room.
Hi,
so I'm going to take Zainab, but say who you are, please.
Hi, I'm Zainab Kurban. I work at the Energy Futures Lab here at Imperial. And my question is specifically for Elizabeth, but anyone else may want to contribute. So it's really just us trying to understand what we could do more from Imperial, especially from the engineering department, when we have an issue which appears to be mostly political and economical. So the political situation in Africa is not enabling for energy access to be conducted at a centralized manner, within a centralized manner, and then you have the issue of affordability, as you mentioned. 80% of the population engages in farming, so you have to create value within this sector to grow the economy for people to be able to afford energy, for instance. So my question arises from a recent call we had from the EPSRC. It's a Global Challenges Research Fund, and that was a very technical call. It didn't really have that much scope, for instance, for business development. So I guess my question is, do you think the way the funding is being done at the moment is actually providing the scope for this holistic approach for working and actually engaging the engineers in the right way to actually address the real issues rather than the secondary issues, which is technical?
Okay, that's great. Some quick responses to that, please. I think specifically asked you, but if others would like to come in.
Yeah, okay. So quickly, thanks for your question. I would say largely there's a lot of technologies out there that work and that can be implemented, and the challenge that people's finding right now is how do we build a business model around this and make it possible for the technology to work in this context. But yes, that's a huge problem, but I think there's a huge amount of space for new technical innovation, for actual solutions that can come in from the engineering departments and be implemented. Batteries, if we can get cheaper batteries, cheaper inverters, that would be super. At the same time, also, if you look at things like grid reliability, which is a huge problem. So even if you have access to the grid, a classical example, a place like Uganda, over 50% of consumers get only 4 hours of reliable electricity a day. So actually some solutions like grid balancing solutions actually would come in and solve problems like that. So I would say, while yes, business models are an issue, technology can always make, sort of break that barrier and solve.
Okay, I'll take Ryan quickly on this one. Our slightly technophobic commentator earlier. But
I think I should somewhat backpedal a little bit. I was speaking particularly about getting electricity to health facilities when I said that I don't think that the required innovations are technological. I think there is large scope for technological innovation throughout the power sector on a number of issues. Innovation in storage is an enormous issue. It will unlock, it has the potential to be the linchpin of unlocking high levels of intermittent renewable electricity on the grid. Innovation in energy efficient appliances will improve the types of energy services that you can provide with off-grid technologies. And so if you can work on innovation in electric cooking, induction stoves, in irrigation systems, anything for productive uses, that could have an enormous impact as well. And innovation in how to manage the grid and added intermittency of renewable electricity beyond storage, I think is also an area that needs a lot of work.
okay, so I'm gonna cut the answers to that question. I'm gonna take the two people that are waiting to come in. I'm gonna take them both, and then go to the panel for answers and any final remarks. I've got the gentleman in the middle here.
Ranjiv Gunawardena, Chairman of International Consultants. My concept here is that we need to look at innovation, and so far there hasn't been much innovation about how to look at this situation. Money can be acquired to resolve some of these problems through corporate social responsibility programs, because most of the oil in the world comes from Africa, and so again you could have a levy upon that to balance off into the health sector. So for instance, if there's collective buying power by the Africans, the African nations, through like IMF or any multilateral agencies, they can collectively reduce the cost of a whole host of things. So this is the way to go forward in my way of thinking, rather than trying to do this privatization. Privatization is fantastic if your economy is developed. If your economy is not developed, like an example was South America when they privatized the utilities, the people couldn't afford water to have, to wash, to clean, etc. So they had to tap into the pipelines. So this is not an ideal situation where European nations have suggested privatization, because they're not sophisticated or haven't got the wherewithal to have a certain amount of volume to make this successful. So the key thing here is that what I would like you guys to think about is collective power is very important, and at the same time looking at solutions whereby you could get together with other nations to bring the cost of the unit of doing things much, much lower. Thank you.
Okay, hold your replies, and I'm going to bring in, I think he has a microphone, Hayden.
Oh, yeah. Hi, I'm Hayden. I'm a recent graduate of the SEF MSc, and I was thinking about how with heat networks and private wire networks as well, an anchor load can often be a great way of making that network economically feasible. I'm wondering if you could perhaps comment on the potential of integrating healthcare centers with the surrounding community to make energy access more affordable for the center itself and for catalyzing energy access in the greater area.
Okay, great question.
Thanks.
Yeah, I'll give two quick responses to both. Anchor consumers are a very big issue when it comes to developing mini-grids. I have not heard of any being health facilities. Most of the ones I've heard of are agro-processing plants or larger consumers, but that may very well be possible. I'd like to hear more if anybody else has further information. In terms of power sector reform, or that was the issue, and whether electricity sectors should be privatized or not, I think it's a case-by-case basis, and there are many different models that can be applied. You don't need to reform the entire sector. You can just have an opening for independent power producers. And I think at least having an opening for private power producers is quite important for unlocking some of the most cost-effective forms of generation, and that's intermittent wind and solar. A lot of the know-how, a lot of the skills exist in private companies, And South Africa and Uganda have had huge success in unlocking investment. I'll pass this down.
Okay, I just want to say one thing, which is I completely agree with what Ryan said, but I think there's a huge issue about having informed public discussion in countries about what citizens want, what approach they want to see to utility reform, for example, and I don't think there's enough of that. And I would just say that for us, in terms of delivering services to the very poorest, then there also needs, I think there's a bit of a trendy thing about at the moment about private sector can solve everything. I think you might need to look at social protection approaches, for example, when it comes to delivering services to the very poorest, because as we've seen, like affordability is a huge issue.
I wanted to say that the innovation may be in the integration between the private and the government, as I mentioned, in the concessionaire approach that was implemented particularly in Latin America. As it was said before, it's not a matter of looking what is new, but what is really suitable to improve specific conditions.
So in terms of sector reform, again, there are certain areas that can be supported by private sector better, certain areas that can be supported by government better, depending on, depending on a number of factors. I'll point to an example in Uganda in terms of extending the grid. One approach that was to create 13 concessions, give those out to potential transmission and distribution companies. But the issue was that the supply of electricity wasn't massively secure. You're looking at electricity losses along the transmission lines of nearly 20%. It's a really intermittent supply, and secondly, demand. There's not much data in place of actually how much electricity people use over the course of the day. So that's one issue, let alone how much electricity they use anyway. So, for a private entity to be able to invest in that becomes very, very difficult. On the power generation side, if they have a clear line in terms of a power purchasing agreement, that makes it easier for them to contribute to that picture. So this ends up leaving transmission and distribution kind of squarely at the door of government in the end. From the point of view of anchor loads, there's been a number of interesting models. Again, I haven't come across one that focused specifically on healthcare centers as anchor loads. However, there's been examples of sort of telecom towers being used as sorts of anchor loads, but then these haven't been replicated in a sort of commercially viable way as of yet in the East African context anyway. So there's been a lot of issues from that sort of point of view. So from those business models, people are actually saying, are mini grids viable? And maybe we should actually look at a completely different approach to mini grids, because ultimately, I think my approach is, if you have an off-grid utility company in rural Kenya and an off-grid and a utility company in Copenhagen, can they really have the same revenue model? And I think that's the question that people really need to start asking, whether you can have the same business model and whether you should actually be focusing more on the specific context where you're at. Thanks.
Okay, I am going to cut it there, but thank you. Thank you very much indeed to all of the panelists and to all of the participants from the audience. We have some tea and coffee available now in 403A, which is, it's that way. Out and then to the left, to the end, there's a Energy Future Lab banner there. Okay, I'm sure you'll follow the crowd, you'll find it. We've eaten into our tea and coffee time, so should I say we'll reconvene in 15 minutes in order to allow time for the next distinguished panel with, I'm sure, an even more distinguished chair. Thank you very much indeed.